Hi guys, John Adamson, the Rehab and Documentation Guru, trying something a little bit different. I'm going to use the rear-facing camera, and hopefully I'm totally in the frame. But I wanted to talk about medications today. And one of the things that we as physical therapists and often occupational therapists see patients for is issues related to dizziness. And in this case, more specifically, I'm going to talk about vertigo. What is vertigo? Well, it's the sensation that there's movement when there's really not. And so people can have lightheadedness, which is different than vertigo. And there are a number of medication classes, and you can look this up online very simply. But when you have patients that have issues with dizziness or vertigo, it's really important that you make sure that you look at their medication list to see what causes might be there. And there's been lots of times when I've reported to doctors who ask me to assess patients for dizziness or vertigo and related functional deficits. Because of that, I've had to respond to them, have you considered the following medication causes for this issue? So here's just a short list of some of the things that can cause vertigo. Analgesics like codeine, antibiotics. I mean, think about how many of your patients are on those. Anticonvulsants, anti-inflammatories can have that effect. Anti-malarials, and that's interesting because they've got hydroxychloroquine on here, which has been used in some patients with COVID. Antivirals, anti-Parkinson's meds, which I've talked about in the past. Of course, cardiovascular drugs, there's a number of them. Gastroenterology drugs, rheumatology drugs, phosphodiesterase type 5 inhibitors. I can't recall if these medicines they have here are listed that I've ever seen a patient on those. And then there are some other ones, including ones that are psychotropics. So anyway, when you look at your patients with dizziness or vertigo, make sure to look at their list of medicines. We should be looking at those anyway because they impact all sorts of things beyond dizziness. Anyway, John Adamson, the Rehab and Documentation Guru, just bringing a little tip related to patient care to you today. Hope you're having a great day. Take care and God bless.